We have 51 tests sent out total. 27 of those are still pending. 6 are positive, 18 are negative. In the hospital, we currently have 5 patients related to the disease. 2 of them are the confirmed cases that are still in the ICU, still on ventilators, and the other 3 are persons under investigation. So today I just had one message for you, and you've heard me talk about this before, but it's specifically when to discontinue the home isolation. So this is obviously going to keep coming up because there are more and more people that are self-isolating at home. So we need to know when to stop isolating at home. So Texas Department of Health has released this. It's on their website. Again, I'll hand it out so it can be posted everywhere. But it specifically gives you the criteria of when you should discontinue. There's 3 parts to this. One is, the top one is the cases, people who have the COVID disease. To put it very simply, if you are 7 days away from when you first started showing symptoms and you are 3 days without a fever, not using any medication to reduce your fever, you're probably safe to discontinue home isolation. That's the simplest way to put it. It's a little bit more complicated than that. You can look at it at home. Household contacts and non-household contacts still are a full 2 weeks for home isolation. So it's just the cases that if you don't have the test available and you want to decide when to discontinue, it's the criteria that I just gave you.
I just want to remind everybody, the phone line Medical Center has set up, if you have some questions or you think you're experiencing some symptoms, is 432-640-2747. That's 432-640-2747. And I know you'll have your number too. Do you have that, or you're going to get that?
It's on the website.
Okay, it's on the regional website, so you can check that there as well. But again, like we said in the last couple of days, if you have symptoms, call in, get to the urgent cares that both of our facilities provide, and let's keep the emergency rooms open for the sickest and for the worst patients. And let's push the rest of this to our phone lines and to our critical urgent care center. So with that, any questions, guys, today? Yes, sir?
The governor sent out some of the non-essential or essential businesses, not essential. They're having churches and houses of worship. They're allowing. They want virtual distribution of the service, but they're also allowing people to come back. How concerned are you, even though you want social separation? Is there any concern that people are going to flock to the churches?
Yeah, I mean, I think in times like this, we all, we know that God's bigger than anything, right? I mean, we all know that. We believe that He's got it under control and He holds our future. But at the same time, I would urge people to be smart, okay? That if your church is holding something local, holding something at the church, be smart with that. I mean, I know people want to pack in there, and we miss our church family too. I mean, we all are experiencing that. But at the same time, be smart with that, especially if you're in the high-risk groups, the elderly, somebody with some comorbidities, small, young children. Be very smart with that and try to practice that. In my opinion, God hears you wherever you are. It's nice to be around fellow believers, and it's nice to get encouragement in your church. But I know that God listens to us no matter where we are, and I think you can be smart with that and just keep yourself safe with that. What else?
The 2 that are in ICU, are they sharing ventilators?
No, sir. I think our number yesterday was we have 32 vents available, so these folks are on their own machine right now. So we're good to go on as far as the ventilators are concerned.
And then out in public, hardware stores, and they are showing that the markings, but couples are still standing within 2 feet. What's your advice?
Yeah, my best advice is practice the distancing. I mean, it's difficult. I mean, these, with your family and with your friends, these are people who are used to being around every day with no restrictions. I don't know, you may have some friends you wish you had restrictions. You didn't have to be around them every day. But at the same time, when you're in these stores, I know I've been to a few stores, and it's hard to tell that we're in a situation because it's so packed. But I applaud the stores I've seen some with shields, guarding the register folks. I think that's very smart. I've seen them with the tape on the floor and the X is on the floor, and that's all fine and dandy unless you have 4 or 5 people crammed on that X. So try to, to use your heads with that, be smart, and try to respect that 6-foot circle around everybody. I think that's wise for everybody. Yes, sir?
I had a question about what drugs are being used to treat those with COVID-19 and who are in-house.
Sure, and that's still an ongoing question. The medical community has some ideas of drugs that may work, and those are the drugs we're using. There's a long list out there, you can look it up, but there are some anti-malarial drugs or anti... Yes, the anti-arthritis drugs, it's called hydroxychloroquine. That is something that we are using. It's probably the only one that's ahead enough in the scientific literature for me to quote to say that is something that we're using. The rest of it is still advice from the front lines, but not proven in the scientific literature yet. So that's the only one that I can say we're using for sure.
Okay. And then also I had a question for both of you. A local OBGYN had announced they tested positive for COVID-19. I heard they worked with Ormc and MCH. Is there any thoughts you have on testing medical personnel right now?
Yes, absolutely. I mean, I gave you guys the priorities when we spoke last time. Healthcare workers that are symptomatic are priority 1 for testing. We want them to turn out negative, and we want them to be in the workforce to take care of the rest of us. So definitely for someone like that, for everybody in his office, my thought is that they are going to get tested and hopefully negative, and then be able to continue work. The last time that specific doctor was in ORMC was the 19th of March, so we are well past that 2-week period of time, so no one in the hospital was exposed.
Okay. And is there any updates on who will be able to take over as patients, or if people will...
Yes, so he's a private doctor, so we don't get to decide that as a hospital, but he has told us who is going to be covering his patients while he's out, and that's the person that's covering them for now. So yes, there is coverage in place.
Yeah, we became aware of that situation today as well, and of course our thoughts and prayers are with the doctor, just the speedy recovery. And I think it's important to know that both hospitals, we have been saying from the beginning, we have to stick with this plan, with the guidelines from the CDC, with what is being recommended. And I think that this provider did that as well, that noticed the signs and symptoms, the exposure, and then was able to get tested and then make sure that he didn't expose anybody else. You know, it's funny, these the providers that we all have, we hold them in highest regard. And they're people too. I mean, we have plans in place. I know we both do. Should a provider become ill, and how we're going to handle that. And I think that we've thought through that pretty regularly over the last month, just to make sure that should we have a provider test positive, which there is, then we have a contingency plan in place, somebody to pick up their patients, somebody to handle what's going on, and make sure that we take the best care of those folks. Yes, sir?
The infants that he was caring for, are you concerned that maybe some of the newborns may be infected? Is that something that you've looked into?
Yeah, I can tell you this guy is going to put nobody in harm's way. So I'm confident that he took the steps necessary to protect everybody, and I think that everybody's just in great shape. I'm very proud of him that he was able to get this out to a lot of people ahead of time and was able to get isolated. And so our thoughts are with him, and man, we want you to get better and recover. Yes, sir.
Do you know how these cases that are positive, where they got their infection? Was it by travel, or was it just around the community?
Yeah, that's a good question. I've heard honestly, a lot of them are from, what I'm hearing is from travel to what they're calling a hot zone or a target spot. That a lot of those are from travel exposure, and it seems most of all over Texas is from travel, that they're picking it up from somewhere else and bringing it back in. And I know the president spoke on yesterday about limiting travel, and now that's even talk about limiting airline travel in the United States. So it seems to be that's a real easy way to move that around is through your travel.
Some of our viewers are buying into the social media, making sanitizing their home because they don't want to get out. Do you still encourage to buy the products that are made for sanitizing? What's your word on it?
Yeah, I mean, I think if you, and I'll let the doc, yeah, here, come on, I'll let you talk about that.
So the CDC also has released the guidelines of how to make sanitizing solution at home. So if you're following the CDC guidelines and you're making them yourself, perfect. Make them at home. Don't leave. That's a good idea.
Yeah, and on the hand sanitizer, that's a very good point. Yeah, make it and stay home. Don't drink it. Don't drink it, but make sure you use it and stay home. I think that's if you're following the guidelines, I think you'll be good to go with that. What else you got? I want to just clarify. Yesterday, I told you about a nail shop. That the name of that shop was Legacy Nails and Salon, who brought that over to us. We appreciate that for them. But again, stay home, wash your hands, keep these hospitals and our providers and doctors and nurses in your prayers. Our people are getting tired. We've been at this for a while, but we know that this too shall pass, and we'll get through this. But please do your part. Stay home. Practice the distancing, the social distancing, and do your part and save some lives with that. Are you okay?
I was just wondering, I know the health department's supposed to get some of their private lab numbers tomorrow. I was wondering if you knew what time that would be, or is that something I would have to ask them?
I think, go ahead.
So last time Brandy was here, she said by 3 o'clock she would post all of those. So I'm gonna probably say that's when she's gonna post it. One final message that I think everybody should really hear and understand. This is not a sprint. We're not looking to finish this off and be done with it in a week, 2 weeks. This is a marathon. This is going to be here for a while. So we need to prepare ourselves while we're talking about this, even though our news conference times may be shorter, frequency may be less. It doesn't mean that message is less important. This is a long-term thing that all of us need to plan for. All of us need to prepare that this could be with us for months. We don't have an exact prediction yet. Some of the models that I helped with releasing yesterday, those are some of the predictions, but nobody knows that for certain. They are guesses. They are very good guesses based on scientific numbers, but they are still guesses. So I just want everyone to hear that.